Thank you for choosing Duke Health for your healthcare needs. Hello, I'm Dr. Talisha Ramchal, a gastroenterologist at Duke Health. During this video, I will review the step-by-step instructions to complete your bowel prep. Your provider selected your colonoscopy prep based on your health history. A bowel prep removes the stool from your colon so your doctor can see the colon lining. Your prep is SuTab. SuTab is a prescription laxative medicine. You will pick up your prep from your preferred pharmacy. The prep items you will need to complete your bowel prep are SuTab kit, 4 non-coated simethicone tablets, dose 125 milligrams, brand name Gas-X, 2 bisacodyl tablets, brand name Dulcolax, assorted clear liquids to drink the day before and the day of your procedure. Examples of clear liquids include chicken, beef, or vegan broth, gelatin, clear sodas, apple juice, and low-sugar sports drinks. Do not drink any clear liquids that are red or purple in color. Let's review each step in your prep. 2 weeks before your procedure. If you take medicines for diabetes or to thin your blood, talk to your provider about your medicines. You may need to stop taking these medicines before your colonoscopy. 7 days before your procedure. Stop taking iron pills and multivitamins with iron. Drink 1 extra glass of water every day until your procedure day. This will help your bowel prep. Remind your driver about your procedure date and time. 5 days before your procedure. Stop eating foods high in fiber like beans, vegetables, fruits, salads, nuts, or seeds. 2 days before your procedure. Stop taking your fiber supplements like Metamucil, Citracel, and Fiberol. At 6 p.m., take 2 Dulcolax tablets with a glass of water. 1 day before your procedure. Do not eat any solid food for the entire day. Drink only clear liquids and take the prep tablets. At 5 p.m., open the SuTab prep kit. Remove 1 bottle of the SuTab tablets and the plastic cup provided. Fill the cup with 16 ounces of water up to the fill line. Swallow 1 tablet every 1 to 2 minutes. You should finish the 12 tablets and the 16 ounces of water within 20 minutes. Drink 2 more cups of clear fluid over the next 1 hour, 16 ounces each. At 6 p.m., take 2 simethicone tablets with a large glass of water. You will want to stay near a bathroom. A few hours after taking the tablets, you will start having many bowel movements. Your bowel movements will be liquid. Continue to drink clear fluids until you go to bed. Review your arrival time for your procedure. Remind your driver about your procedure time and location. On your procedure day, do not eat any solid food until after your colonoscopy. Continue to drink clear liquids. 5 hours before your scheduled procedure, remove the second bottle of the SuTab and the cup provided. Fill the cup with 16 ounces of water up to the fill line. Swallow 1 tablet every 1 to 2 minutes. You should finish the 12 tablets and the 16 ounces of water within 20 minutes. 4 hours before your procedure, take 2 simethicone tablets and then stop drinking all fluids. Follow your provider's instructions about your morning medicines. Take your medicines with a sip of water. 2 hours before your procedure, your bowel movements should be clear green or yellow. If you're still having solid or brown stool, please call Duke GI and speak to a nurse. Keys to a successful colonoscopy. Review the printed procedure instructions. Pick up your prep supplies. Watch the step-by-step prep video. Review your procedure date, arrival time, and location address. Remind your driver about your procedure date and time. Complete the bowel preparation. Follow your provider's instructions about your medicines. Your prep videos and printed instructions are available in the digital care section of your Duke MyChart. If you have any questions about your procedure or prep, please call Duke GI at 919-684-6437.